ZASAM and greetings to the new medical students. My name is Royd Kwibisa and I am a student of medicine here in Fez, at the Faculty of Medicine in Fez. And I'm going to talk about medicine in Morocco in general, which I believe is similar. The system is similar from faculty to faculty, which also permits students to transfer their studies, their medical studies, from one faculty to another. So we learn basically the same thing. So yeah, when I talk about medicine, it will be a general thing. I'm tempted actually to talk about my experience, but if I begin, we'll not be able to finish on time, and we'll be able to do that when you come, hopefully, and when we get to meet, for some of you that will get to meet, or you hear it from other medical students that in Morocco the experience is different from one person to another, but at the end of the day, it's similar. We pass through the same system. So where can you study medicine in Morocco? We have about 7 cities where you have a faculty of medicine, or these are actually universities. Each city has its own university under a particular name. So we have about 7 universities so far that offer medicine in Morocco. The Rabat University, Mohammed Sank, being the oldest faculty, then others follow. Then so we have Rabat, Fez, Casablanca, Marrakesh, Tanger, Oujda, and Agadir. I forgot to add it, but Agadir also offers medicine. So what is the total duration of medical studies in Morocco? So we have 7 years to do everything in Morocco, and this 7 years is divided in cycles. The first cycle being first and second year, which is purely theoretical. You go to school and you learn from doctors teaching you how to be a medical doctor. Basically, you learn anatomy, biology, learning methods, communication, biophysics. Those are in first year. In second year, you learn anatomy also, you learn physiology, semiology, and you learn also hematology, first aid, among other subjects that are relevant to those years. Then in second cycle, which is from third year to fifth year, your medical studies get to expand. They add the theoretical part, they add the practical part, which is the most important. So you do your practical in the morning from 8:30 to 13 hours. Then from 14:30 to 18:30, you get to do your theory. You go to school and you get to be taught pathologies and other relevant subjects to a particular year. I believe this can be different from faculty to faculty. I'm talking about Fez particularly because I'm in Fez, and that's what we do. We go to the hospital in the morning, and in the afternoon we go to class. Then in third cycle, which I'm entering at the end of this year, which is 6th year and 7th year. In 6th year, it's purely practical. So you go to the hospital in the morning, 8:30 up to 17:30 or 17 hours, and you get to now be integrated in the hospital system, how it works, from the admission of the patient and finding their diagnostics, treating them, and discharging them. So you get to become a doctor basically, and they teach you more intensely. You start applying your theory much more. Then in 7th year, it's basically also theory. You go to peripheral clinics now, where you tend to practice as a doctor. Now you are not a student like who is monitored every single step. Now you're a doctor. You get to make your own prescriptions and follow up the patients. And yeah, at the end of your 7th year, or in the middle somewhere, you get to do exams which are called clinical exams. After doing those exams, you basically be given a subject, or yeah, you choose a subject which you are going to prepare an intense study on, and that is going to be your thesis. You are going to defend it in front of a jury, and yeah, they are going to give you marks from that, and you graduate as a medical doctor. But before you graduate as a medical doctor, so yeah, this part is the cycle which I explained. But we have other opportunities. I would like to spend some time on the opportunities. So at the end of 5th year and 6th year, there is a special exam that you get to participate in, which is a concours. So it's called, the first one is called Concours d'Antenne, which, like I said, it's at the end of 5th year and 6th year. It's a competition. A concours is just a competition where you get to compete for the number of places that are given. So a year in phase we are given about 80 places, and we are about 500 and more students in a promotion. So I think everyone has the same right and opportunity to participate. So it's actually an intense competition. Imagine out of 500 they need 80 people, so you really need to study. And what is involved in this competition is everything that you have covered from your first year. Your anatomy and your biology makes part of this kunku, and then there are pathologies and the different medical specialties that you have covered in your 5 years. So you get to do this exam. When you pass it, you do your 6th year and 7th year in a more intense manner, and those are the 2 years of internship. You become an intern. So your 6th year will be intense, your 7th year will be also intense. So this is, you get to actually prepare for a specialty. Actually, when you get this kunku, when you pass, you are assured of a specialty. So at the end of these 2 years of internship, you are going to go direct to the specialty. For the Moroccans, it's based on merit, but for us, you get to choose. You are allowed to choose the specialty that you want. That's the information I have so far, and I pray that it remains that way for the future medical students that are coming from Zambia and other foreigners. So at the end of your 7th year, you have a second competition, which is called Concours de Residana. So Concours de Residana also has a limited number of places. So when you finish your medical studies and you want to directly specialize, you get to prepare almost the same program you get as the internship concours. You get to revise everything from your first year until your 5th year. All those things that they taught you, you are given a program and different things to study, how they are prepared, and you prepare, and when you pass, you get to specialize. And what specialties can they offer you in Morocco? What things can they train you as a specialist? You know, so from the head, you can specialize in neurosurgery, neurology, ophthalmology with the eyes, ORL with the mouth and your larynx and your thyroid gland, traumato and orthopedic surgery with your joints, your bones, and those things. Pneumology, which your lungs and sicknesses of the lungs. Cardiology, cardiovascular surgery, your heart and surgeries of the heart. So cardiology is a medical specialty, is a different specialty. Cardiovascular surgery is a different specialty. The same thing with neurology is a medical, and neurosurgery is basically a surgical. But when you talk about ophthalmology, is medical surgical specialty. So you get to treat medically and surgically. Also traumatology, traumato-orthopedic surgery. Then gastroenterology also is a medical, it's a medical specialty. Then you have endocrinology, you have gynecology and obstetrical, you have nephrology with the kidneys, and urology, which is operating on the kidneys, the bladder, the urinary system in both women and men. Then vascular surgery with the vessels, of the body. So these are the different specialties that they can train you in. So they are quite a lot, and I'm sure I've left some here somewhere, like for example the visceral surgeries, which operating on the organs of the abdomen, and other surgeries, for example, that I've left out, I'm sure. So there are quite many. You come, and when you advance in your medical studies and when you get to be sure on what you want to specialize in, you can choose and you can battle for those concours that I mentioned, and you can have that access to specialize in the courses that I've mentioned. Or you can go back to Zambia at the end of your 7th year, where you go and do your license exams, and you get your license and you start practicing as a doctor. And you can also specialize in Zambia. I'm not just familiar with the system, so I'll end here and wish you all the best with your starting of your medical school, and hope we get to interact if you come to FAIRS. And if you go to other cities where there are medical students, you get to interact with them, get to ask them questions and their experiences and their and other things that are relevant also to medical studies, methods to study, because here you'll be taught in French. So sometimes we in first year we tend to battle with adaptation. You don't really know whether you're understanding and what to do, and it takes a lot of time. So if you have seniors, get close to them, ask them questions, find out what they did to pass their first year, and it will be easy for you. So best of luck, and see you in the question time, that the other session of questions, that where you get to ask me questions. I'll be there, and see you, and yeah, good luck.